Hello, I'm Deepu Thomas, a board-certified geriatrician working at Baystate Medical Center. I'm also the medical director for the Acute Care for Elders unit at Baystate Medical Center. I'm honored to be invited by the Springfield Dementia Friendly Coalition to be part of Springfield's Healthy Brain Initiative in an attempt to reduce the risk of Alzheimer's disease and related dementias among Springfield's residents. To be fair to me, this is a very big topic, and it is very hard to concise and discuss within 15 minutes. However, today, I will focus on the importance of diagnosing dementia early on in the disease process, and what are some of the things to keep in mind to try to reduce the burden of dementia. Perhaps I should start with what a normal brain is and its functions are. The brain is the most complex part of human body. It is a very fascinating organ and is the seat of our intelligence. It interprets our senses, it initiates body movements, and it controls our behaviors. Brain is made of small fibers called nerve cells or neurons. The body of neurons form the gray matter, and the axons or the tail end of neurons form the white matter. The gray matter is the outer part of the brain, and white matter is closer to the center of the brain. The gray matter is where the processing of information like sensation, perception, vision, taste, or cognition takes place. The white matter provides communication between different gray matter areas and between gray matter and the rest of the body. Did you know that different parts of the brain have different functions? For example, our reasoning, logic, planning, and emotions are controlled by the frontal lobe. It helps store short-term information and allows one idea to be kept in mind while other ideas are being considered. Speech is controlled by the temporal lobe. Vision is controlled by the occipital lobe, so on and so forth. What happens in Alzheimer's disease and related dementias? First of all, dementia is an umbrella term used to describe a large range of neurologic conditions affecting the brain function that worsens over time. It notably affects persons' ability to remember, but also their ability to think and reason to levels that affect daily life. This includes activities such as managing medications or managing finances, or driving or shopping, or what clothes to wear for each occasion, or even basic activities like toileting or showering, and even feeding oneself. Some people with dementia cannot control their emotions and their behaviors. In some cases, you may also notice subtle or significant personality changes. The most important fact to remember is that dementia is not a normal part of the aging process. I repeat, dementia is not a normal part of the aging process. Although it is seen commonly in older adults, it can also be seen in younger adults. For example, conditions like early onset Alzheimer's disease or frontotemporal dementia can affect people who are younger than 60 years. You might also have heard the term mild cognitive impairment, or MCI for short. This is a condition where a person has cognitive impairment, but not to the point of affecting their daily activities. The key distinction between dementia and mild cognitive impairment is that in dementia, the cognitive changes interfere with day-to-day activities, whereas in mild cognitive impairment, they may make these activities very challenging, but they are successfully completed independently. What causes dementia? Dementia is the result of changes in certain parts of the brain that are caused by the damage to the nerve cells and its connections. This damage can result in those nerve cells to stop working and thereby affecting the function of that part of the brain. The damage can be either progressive, like in Alzheimer's disease, or it could be a one-time insult, like in stroke or traumatic brain injury. It could be also associated with other medical conditions. Alzheimer's dementia is the commonest form of dementia. Other causes for progressive dementia include Lewy body dementia or frontotemporal dementia or dementia with Parkinson's disease. There are some rare causes as well. In these conditions, there are abnormal proteins that bind to the nerve cells and damage them. However, vascular dementia occurs when a person gets stroke or injury to small blood vessels carrying blood to the brain. Some patients may have what is called mixed dementia, where one can have two or more causes for dementia. For example, someone with Alzheimer's disease can have a stroke and have vascular dementia. This sounds all doom and gloom. However, there is hope. And the hope is that we can reduce the burden of dementia on individuals living with it, as well as for their caregivers. It is very important that you work very closely with your primary care providers. They can help you with screening, diagnosing, referring to specialists, and navigating care for someone with dementia. How do we reduce the burden? Well, one way is by improving your cognitive reserve or cognitive capacity. It reflects how agile your brain is in pulling in skills to solve problems and cope with challenges. A larger cognitive reserve can cancel out damage caused by dementia process and help the person continue to function as usual. How can you improve your cognitive reserve, you may ask? Different lifetime activities can improve your cognitive reserve. Some of these include longer formative education, an active social and intellectual life throughout the adult years, reading books, staying physically fit, proper sleep, that means 8 hours of sleep at night, correcting sleep apnea, avoiding medications that contribute to cognitive decline, correcting hearing loss, and correcting vision loss, as well as eating healthy food. Another way we can reduce the burden of dementia is by diagnosing dementia early in the disease process. Early diagnosis will help implement early intervention, which may sometimes help slow down the progression of dementia. There are new medications, the so-called disease-modifying treatments, that are currently being used, and some in the pipeline that could potentially alter the trajectory of the disease. In addition, there are medications that have been tried and tested, like cholinesterase inhibitors or NMDA receptor antagonists, which can turn the clock back a few months on memory loss and functional capabilities. This might also help reduce some unwanted behaviors. Diagnosing dementia early also help with early access to care and thereby reducing the family and the caregiver burden. Not knowing why your loved one is behaving the way they are, asking questions repeatedly, or doing things that are not appropriate puts the caregivers and loved ones in a very precarious spot. Imagine someone who spends a lot of money unknowingly, or is a victim of a fraud, or not taking their medications appropriately, or gets into frequent accidents or getting lost while they're driving. These could potentially risk their lives and make it more challenging for caregivers. If caregivers or family members are knowledgeable about these changes, they can request for more help and support before burning themselves out or before anything bad happens to their loved ones. Planning for the future is another critical area for people who live with dementia. The average person with Alzheimer's dementia lives approximately 4 to 8 years from diagnosis until death, with a range being approximately 4 to 12 years. As the disease progresses, one's ability to do daily activities, ability to control the bowel and bladder functions, ability to speak words, ability to walk, and even ability to sit upright will be affected. It will come to a point where they can no longer smile or recognize their loved ones, or even hold their heads up. At a certain point in time, they will lose the ability to make sound decisions, and they will lose their insight. Hence, it is important that early diagnosis is made so that they can make arrangements for documents such as appointing a durable power of attorney for finances and for healthcare. They can also address things like banking or paying bills or driving, which I know are very difficult decisions to make. They might need to have physical environments within their home changed. Many times, They may need to change their residence, either family members moving in or moving in with a family member, or some people needing to go to assisted living facilities or retirement communities, or sometimes even long-term care facilities. People who live with dementia and their family members also need to ask about what matters most for them and what quality of life is for them. This also includes completion of a form called MOLST form, which stands for Massachusetts Order for Life-Sustaining Treatment. Unfortunately, as the disease advances and when they reach the end of their life, the outcome of any resuscitation or aggressive treatment like intubation and ventilation is going to be detrimental and more traumatizing for those with advanced dementia and with no major benefits. It is my opinion that at the end of life, the goal of therapy should shift to that of allowing the person to die with dignity and comfort, in alignment with their goals and values. So, to summarize, dementia is not a normal aging process. It affects not only memory, but also affects different parts of your brain, resulting in inability to perform things you would normally do. Lifelong activities like longer formative education, an active social and intellectual life throughout the adult years, reading books, staying physically fit, proper sleep, correcting sleep apnea, avoiding medications that contributes to cognitive decline, correcting your hearing and vision deficits, and eating healthy food can improve one's cognitive reserve. Early diagnosis will help you plan for your future, reduce caregiver burden, and in some instances get the treatment that might change the trajectory of the disease with newer medications in the pipeline. It is important to address what matters most, safety concerns, and goals of care early on in the disease process. Don't wait till the last minute or when one gets admitted to the hospital to make all these decisions. With advanced dementia, the goal of therapy should be shifted to allowing the person to die with dignity and comfort. I thank you for this opportunity to speak about something that I really care about. And I hope that at least some of you will be empowered to talk to your healthcare providers or your loved ones' providers regarding any cognitive concerns. Don't wait.